Vanakkam, good morning. In this video, we are going to discuss about the peculiarities of coronary circulation. This is the long question in January 2023, Dr. MGR Medical University questions. Blood supply of the heart. The heart is supplied by the left coronary artery. This is the left coronary artery in this image. Left coronary artery supplies to the left atrium and left ventricle. This is the right coronary artery. It is supplies to the right atrium and right ventricle. This is the right coronary artery. The right marginal artery is the branch of the right coronary artery. Posterior interventricular artery. These are the branch of the right coronary artery. Left circumflex artery and anterior interventricular artery. These are the branch of the left coronary artery. Both the left and right coronary artery arise from the base of the aorta. Base of the aorta behind the aortic cusps of the semilunar valves. Physiologically, it has no anastomosis between the left and right coronary arteries. These are functionally end arteries. So this is the functionally end arteries. So the blockage of the particular end portion, it will affect the particular area of the heart. And the cusp, the sinus valsalva is the outposting of the aortic valve cusps. So that place the coronary arteries are originator. So that place produces the eddy currents. It keeps the valves moves away from the wall of the arteries. So it will use the blood supply during systole also. So this is important for the receiving the heart during the systole and diastole. Heart receives the more blood supply during the diastole compared to the systole, but systole also it will receive some amount of the blood. Venous supply of the heart. Heart has the various venous supply. The major system is the coronary, sinus and anterior cardiac vein drain into the right atrium. The minor systems are arteriosinusoidal vessels and Debasian veins, arterioluminal vessels directly enter into the cardiac chamber. Innervation of the coronary blood vessels. It is supplied by the sympathetic nervous system. The coronary blood vessels has the more number of the beta receptors, so it produces the vasodilatation. Stimulation of the sympathetic nervous system produces the vasodilatation through beta receptors. Parasympathetic stimulation also produces the vasodilatation due to the act via the cholinergic receptors. Special features of coronary circulation. Heart receives the more blood supply during the diastole. During the systole, the ventricular compression is more, especially in the left ventricle. So that time the blood flow to the heart is decreased through the coronary circulation compared to the diastole. So more blood supply is received from during the diastole, especially during the endocardial region receives the less blood supply during the systole. So the subendocardium is more prone to the ischemia and infarction. Ischemia means reduced blood supply to the particular area of the heart. Infarction means permanent loss of blood supply to the particular region. coronary arteries are functionally end arteries. So the lesion in the particular area of the arteries affect that region of the heart. Okay, lesion in the particular vessels affect the particular regions of, suppose especially if the lesion in the left coronary artery means it only affect the left ventricle and left atrium. Okay, and metabolic regulation is very well developed in the coronary arteries. It can meet the demand of the activities. So it during the exercise and during the activities it needs more oxygen. That time the coronary blood supply is 4 to 5 times increases to meet the demand of the oxygen. No anastomosis between the right and left coronary arteries physiologically. So already we explained, during the exercise the coronary blood supply is 4 to 5 times increased. So that will meet the demand of the oxygen during the exercise. Okay. The main fuel of the coronary circulation heart is the fatty acids. 1/3 of the fuel is the fatty acids. Other fuels are glucose, pyruvate, lactic acids, amino acids. These are the other fuel. Major fuel is the free fatty acids. 1/3 of the fuel is the free fatty acids. So coronary heart receives the more oxygen extraction. 80% of the oxygen extraction from the arterial blood supply. During the rest also arteriovenous oxygen differences is very high. So it receives the more oxygen from the coronary circulation. The normal weight of the heart is around 300 grams. It receives the 250 ml per minute. It receives the blood supply average amount is 250 ml per minute. So it is, otherwise we can express as it can receive 85 ml per 100 gram of cardiac tissue per minute. 85 ml per 100 gram of cardiac tissue per minute. So it is the second organ receives the more blood supply. First organ is the kidney. Okay. So it has a high oxygen consumption. It is 9.2 ml per 100 gram of tissue per minute. Summary of coronary circulation. Coronary circulation is important because it supplies to the heart, especially through the left coronary artery and right coronary artery. It supplies blood to the 250 ml per minute or 50 to 50 ml per 100 gram per minute. It has a high oxygen extraction from the blood to the heart. So it is regulated by the nervous system, especially sympathetic, parasympathetic, and autoregulation stimulated by the hypoxia, hypercapnia, acidosis. It is mediated through the adenosine, and reduced blood supply produces the myocardial infarction. Permanently reduced supply produces the myocardial infarction. Temporary reduced blood supply produces the myocardial ischemia. And the treatment is, we have to give the nitrates and calcium channel blockers, streptokinase, tissue plasminogen activators, and coronary artery bypass graft. These are the different treatment modalities. Thank you for watching this video. Those who are not subscribed the channel, please subscribe. Thank you once again.